A new treatment that just may put you to sleep. It's a cure for snoring that may be the answer for so many that suffer from it and their partners who suffer with them. Tanya Rivero is here with a look at a simple surgery that is helping at least one couple get back together.
George, Robin, chronic snoring is such a unique medical problem in that the person afflicted often doesn't suffer at all. It's the poor spouse or partner who must bear the burden, and it's a huge problem. By some estimates, 30 to 50% of Americans snore. Multiply that by 2, and you've got lots of couples affected. We met with one who says this procedure may have saved their marriage.
I was a desperate woman for sleep.
For 25 years, Dan and Pam Starkey's marriage has been interrupted by one noisy problem.
The snoring has lasted a long time. We've been married 25 years, and it's lasted all 25 years, but it's gotten progressively worse as we have gotten older.
There have been occasions when I've snored myself awake, and I wake up and I don't really know why.
I do.
The couple tried all sorts of remedies.
The tennis ball sewn into the T-shirt.
We had a little electronic thing.
Then he had a rotor-rooter deviated septum.
I had part of my uvula removed. Don't ever do that.
The mouth device.
Oh yeah, there's an oral appliance.
Little piranha.
After 10 years of sleeping on the couch, Dan decided to take his snoring setback into his own hands, or sinuses. He participated in a sleep study and learned about something called the pillar procedure.
This is the pillar implant. As you can see, it's made of polyethylene. It's soft. It goes into the soft palate, and we typically put 3 to 5 of them and line them up. And the body forms a bridge of scar tissue between them, which reduces the vibration of the soft palate.
The pillar implant is tiny, less than the diameter of a nickel, but it's had a huge impact on sleepless spouses who say it's worth its weight in gold.
Many of these patients have a serious health issue, and the ones who don't, who are just suffering from snoring, have a serious relationship issue. And you can laugh at it, you can scoff at it, but something needs to be done, or both the person who snores and their spouse or significant other is going to have a lower quality of life than they otherwise should.
It was pretty simple. It was very simple.
As a matter of fact, I didn't know he was doing this. He came home and told me about it. I was like flabbergasted.
It was really kind of a non-event and worked just like a charm. It was really pretty cool.
Experts caution the pillar procedure is not for everyone.
The problem with the pillar procedure is that it doesn't cure the sleep apnea. It may improve it, but it doesn't provide a cure. Perhaps 50% of the patients do better. The other 50% of the patients don't show significant improvement.
But for Dan and Pam, it's sweet and silent dreams together.
Before the procedure,
here we go.
It was more like a, which absolutely drove me crazy. This is not conducive to a good night's sleep. And now it's kind of more of a gentle.
And there are some other surgical procedures that have seen some success, so if you think you're a candidate, of course, consult your doctor. But here are some basic tips to reduce snoring. Sleep experts say don't drink at night. Alcohol sedates the muscles in the back of your throat, making it more likely you'll snore. Sleep on your side, not on your back. Lying on your back causes your tongue and soft palate to collapse into the back of the throat, which leads to snoring. And hands down, the best thing you can do is lose weight. Excess weight around your neck restricts airflow.
All the simple things. But that was kind of a brutal imitation she did of him.
Well, when you've lived with it for that long, I guess
right,
you know it well.
Right. Okay, Tanya, thanks very much.